So we're here today with Dr. Amy Hartsfield from TMJ and Sleep Solutions of Alabama. We are doing a whole series of videos based around what she treats in her practice, which is things like chronic facial pain, headaches, sleep issues, fatigue, anything related to those types of problems. Dr. Hartsfield is dedicated to listening to her patients on a whole different level, and just making sure she understands the whole person and that she's treating what's actually wrong, as opposed to just treating the symptoms. So in this particular video, we're going to talk about your story, because I know that your story relates a lot to what you do now.
Mm-hmm.
You told me earlier that it was a major reason that you got into what you're doing. And so I just want to hear a little bit about that. So let's just start with your personal journey with mast cell activation syndrome, dysautonomia, and sleep apnea.
Okay. Thank you, Anne, for having me.
Mm-hmm.
For so long, I feel like people have, like, patients and my team has wanted to, like, me to tell my story. And I've just been very hesitant. People are like, you should write a book. And I'm like, oh, I do not like writing, and I'm not going to do that. But now with Chat GPT, it might be an option.
Right.
You know? So, I would say that I can't say about each individual diagnosis came at one time. Like, it has been a journey.
Okay.
So, going back to even like college and things like that, I had headaches and pain syndromes and not knowing exactly what they were. And so we fast forward, and also like hormonal issues, like it was very hormone related.
Mm-hmm.
And so, I feel like, you talk about the mast cell activation syndrome, sleep apnea, and dysautonomia, like, basically, if you know anything about these are kind of like almost like buzzing right now, because after COVID caused mast cell activation syndrome, and some people caused dysautonomia. Wow. We were crazy before COVID. Basically, we were the crazy patients.
Okay.
So it took me a long time to be able to get everything that was going on with me under control.
Mm-hmm.
So, I mean, going back to, I was in dental school, and my background is dentistry or whatever. And so to help my headaches and migraines, we had to use a birth control, and so, but still we didn't know what was going on, you know? So it's just, I mean, this was a long time ago, so, and so we used that, and it got me through. It got me through. It kind of limped me along. But then graduating and getting into practice, I ended up starting having severe pain. And, it was basically neck up, but then it started being other joints. But I started mainly with the neck up, and everybody was like, I would go to doctor after doctor. I saw I started with dentistry, TMJ disorder was what I went to an orthodontist, and he was like, I said, I want to have braces again for my TMJ disorder. And he was supposed to be the top person in my city, for it. And he looked at me and he said, Amy, that's not going to help you. I'm like, I don't care. It will. Just do it.
You were so desperate.
And I went to an endodontist saying, I'm going to need a root canal on this tooth. And he's like, Amy, you don't need a root canal on that tooth. Well, you can have something called a mid-face migraine. And a mid-face migraine is basically you have a toothache with it. And so, because migraines are controlled a lot by the trigeminal nerve, and the teeth are fed by the trigeminal nerve. So luckily for me, I had a great endodontist who didn't do a root canal on me, because it really presents a lot like that. Then going from there to neurologists for doing injections into my neck. They were blaming my career as being a dentist. I just started. I was in my late 20s.
Yeah.
And so they were saying, oh, it's posture. I'm like, how can that be? I just started,
Right.
I had injections in my neck, to rheumatologists saying, by this point in time, I was having joint pain everywhere. And they were like, there's a history of rheumatoid arthritis in your family. You're going to have rheumatoid arthritis. And this is a funny story. I was like going going to a conference out in Arizona, and birth control, again, remember I told you that helped control me. And I'm like, oh, good. I don't need birth control, because actually I had infertility issues. And I'm like, I'm infertile in the first place. Like, I don't need birth control. And I got out there and I stopped my birth control, because he was like, he just took all my numbers and he was like, I know your rheumatoid factor is going to come back. And I ended up in a tailspin because I had stopped my hormonal treatment. And then I get back to find out I don't have rheumatoid arthritis. And so I suffered for so long trying to get answers. So I had my mentor in dentistry who had bought his practice was like, Amy, like there are these devices that you can make for sleep apnea. Like you should really get into that. And I was like, okay, and he was like, well, you don't have to bend over, and it can be a thing. Well, I'm a person that if I'm going to do something, I'm going to do it right.
Yeah.
So then I started studying sleep. So I studied sleep and I was like, learning all about it. And I learned that you can actually you can go and be boarded in it. So I had to study all this and do all these things to be able to get boarded in it. And as I'm reading, I'm like, oh, you're not supposed to wake up gasping? Like, that's the thing? Because after pregnancy, I was very chronic after pregnancy. And I would live for my child to take a nap in the afternoon on a Friday.
So exhausted.
So I was so exhausted.
Yeah.
And I would sleep. And I woke myself up from a nap with heart palpitations so bad that I couldn't control them, that I took myself down to the ER to be told that you have anxiety and you need to take something. And I was like, that something is wrong.
Yeah.
Well, then I was like, okay, well, I'm going to sleep study myself. There's no way. There's no way. And my dad had sleep apnea, but he was a big man and he could peel the paint off the wallpaper off the wall, snoring. But I'm like, I'm small, I'm little. But when we went and dove into it with an in-lab, because it's very important for someone like myself or a chronic pain patient to have an in-lab, because I never would have been picked up on a home sleep study. I had perfect architecture. I hit every stage of sleep. But my REM sleep, your dream state of sleep, I stopped breathing 19 times per hour.
Wow.
And I had mild sleep apnea, but that's what I'd do. I'd wake up gasping from dreams, and then that's when I'd get the heart palpitations. And, sleep apnea is linked to, a lot of heart problems.
Yeah.
And especially, I didn't have AFib, it's PVCs, but, 50% correlation with AFib,
Wow.
So I was just kind of being ignored. So I started there, and as that journey was, I was going to learn dental sleep and get boarded, I met a friend, a colleague, and I said, I really want to do pain. And there were two associations in dentistry, and one is more credible than the other, and I didn't know. And he guided me, and he was like, you should go and learn this. And so basically, those two things were taking place out in Arizona. I came back to my Arizona. I had a conference there, came back. I told my husband, I need to go to this other conference in 2 weeks, you know? And so I went to that conference and I learned that a lot, they can treat migraines, they can treat TMJ disorder, they can treat toothaches that aren't toothaches. And I'm like, oh, I know that. I've got experience that.
Yeah.
And I came back and I learned it was going to be the new specialty in dentistry. So I came back and I told my husband, I need to take 500 hours in 2 years so I can sit for board. So I had a very understanding husband. And at this time, granted, things were still going on with me, swelling of legs. I was pretty much under control with headaches and stuff. I treated my sleep, but there were still some things going on. I still had a pain syndrome. So I went and I did all that, boarded, and then started my journey in sleep and pain. And so with that, I'd say, prior to that, I forgot to mention the dysautonomia diagnosis. So I had dysautonomia for the first time in dental school when we had to take a certain medication. So at that time or whatever, and it's kind of complicated to explain, but anyways, to be in clinic. And so I passed out. And I'll never forget, again, it was told me it was anxiety. So I was diagnosed after my son with dysautonomia.
Okay.
But I could not take the medicines. I had to find, I have reacted to a lot of them. I reacted to, bless my physicians who were trying to help me, because I reacted to every medicine, like birth control. We had to find the most perfect one that wasn't giving me heart palpitations, wasn't causing me pain. It was a whole ordeal. So that being said, that is actually the mast cell activation syndrome. So a lot of people have dysautonomia and mast cell. They kind of can correlate.
Okay.
And so that's when you react to a lot of different things. It causes swelling. It causes foods, and medicines and, perfumes and all this stuff.
Wow.
So, kind of fast forward, I was starting to treat patients for pain and everything. And I knew I had like kind of swelling issues. I knew I was sensitive to things. I mean, I almost wanted to live in a bubble a little bit, you know? And then I learned mast cell activation syndrome. And then COVID hit, and COVID caused mast cell activation syndrome and dysautonomia in some people. And it was interesting to me, like I remember having a patient who is married to a cardiologist whose daughter had dysautonomia after COVID. And prior to COVID, like nobody believed in it, including her own dad, who was a cardiologist. And it does have to do a lot with your heart and your vagus nerve communication. And he did not believe in it until his daughter was diagnosed with it.
Wow.
And now I'm sure he's a big advocate to helping these patients. But my diagnoses, pretty much, besides migraine, were like, you're the crazy patient. You can't take medicine, go on, you know, whatever. Yeah. And so there are medicines and things, there are treatments for this. You know, I treated my sleep. That helped tremendously. But I started treating the dysautonomia with things that treated my mast cell, you know, so that helped tremendously. Diet change. I did very well with diet change for a long period of time until the lovely thing of COVID and menopause happens, you know, so you can do a lot there, but and hormones I did, you know, of course, then that's why menopause is, and perimenopause is important. Hormones drop off. But yeah, it's really hard because patients like myself are not being heard. I feel like it's better in the last couple of years, you know, but we have patients that'll call the office and they're like, oh, I heard she treats mast cell. And my team will come to me like, can you treat them? I'm like, I'm sorry, I can't if they don't have pain or sleep issues. Like, you know, I'm going to limit it to that. But we need more awareness and we need more providers to understand how to treat these because it's real. We're not crazy.
Yeah, it's not just all in your head.
It's not all in your head. And so, I mean, and it does. Those things, I don't blame the providers for trying to treat anxiety or depression, like when I was chronically fatigued. But those things lead to inflammation in your body. And when you have inflammation, you get tired.
Yes.
You know, you're tired all the time and you're anxious, you know. So I don't blame them, but you're covering up a symptom. You're not treating the actual disorder, you know? So if you know the medication's proper for that, then it's not hard. It's hard, believe me, because I'll have some mast cell patients that one thing works for them and it doesn't work for another patient. So you have to know all of your stuff. So I feel bad, for the providers who have to treat us. And, you know, I have a group of friends, great friends that I've met over the last few years, and they're colleagues, they're physicians, they're nurse practitioners, they're pharmacists. And I always say, hey, you know, I know I'm that complicated patient, you know, and they love it. So they like, okay, Amy, what works for this? You know, what can I do for this patient?
Yes.
And then I'm always like, you know, if we think a new treatment's going to help something, I'll be the guinea pig, you know, like, you know, just to help patients to see if that might be a good thing for mast cell or a good thing for dysautonomia.
Yeah.
So, so that's kind of my journey. It's a long one. It really is.
Thank you for sharing it. And obviously, having gone through all of that and feeling like the crazy patient and feeling like you weren't heard, I mean, tell me a little bit about how are you applying those kind of things in your practice today?
Good, yeah, to be heard.
Yeah.
To be heard. But trying to get to the source of everything. I mean, it is hard. But listening to them, you know, that I see it so many times. I can't take medication. And I'm like, I get it. I understand it.
You've been there.
But there's other modalities. So I try to understand that. Like I have so many patients that are like that they've been dismissed, and showing them that there are some medications that they can take. Like, I mean, for instance, it has to go as far as like dyes and food. And so those patients, and as of myself, like we can't take a normal pharmaceutical that has dye. All pharmaceuticals pretty much have dyes in them for the most part. I mean, your capsule is red and green or whatever.
That's true. I never thought about that.
So you have to order it from a a pharmacy that compounds, and they put it in a dye-free capsule.
Okay.
I mean, it's a thing that people don't understand. And I just tell people, like, dyes aren't good for you. We're just we just have the sensation of they're not good for you, you know. But you can tolerate them, and I can't. You know, I always say we're the canary in the coal mine. You know, so like I stay away from processed foods because the processed foods don't bother you, but they're not good for you.
Yeah.
But it's like we're the canary in the coal mine. We're like, hey, screaming over here, it's not good for you.
Yeah.
You know, it's not good for
and
you.
I'm in pain now.
So, but we have to stay away from a lot of those things.
Wow.
Yeah.
I would love a comprehensive list of everything that bothers you so I can avoid it.
Yeah, I know.
Just go ahead and okay, so if someone is listening to this video or watching this video and they're thinking, wow, that's me. I've tried everything. I feel like I'm not being listened to when I go to the doctor's office. What do you want them to know? What would you say to them?
There's hope. There's hope.
Mm-hmm. And what should their first step be?
Finding a person that understands that. There's hope. Sorry.
No.
There's hope. If you have somebody that understands it. And then always, like, I always quote the forefather of orofacial pain, one of the forefathers, Dr. Weldon Bell. Follow the man that's seeking the truth, not the one that's found it. I don't have all the answers for mast cell. We're still discovering them. But find someone that's trying to find the answers, not someone that knows it. If they walk into my office and I say, oh, and you're the patient, I'm like, oh, Ann, I got this mast cell. I know how to do that.
I know everything about that. Yeah.
No. Okay. And so I always try to remember that. Follow the man that's seeking the truth, not the one
I love
that's
that. I love that.
Yeah. So I would say another thing is that as providers, we took a Hippocratic oath.
Mm-hmm.
And the Hippocratic oath is do no harm. Mm-hmm. In mast cell activation syndrome and dysautonomia, there's a lot of harm that can be done without the provider knowing it. But they need to seek beyond that, because making sure they're not doing harm to these patients, like finding an answer for them,
right?
And just continuously trying to turn over every rock, because it is important. Like I was harmed by a lot of medications, a lot of medications, and it's not the provider's fault. But remember that Hippocratic oath for them is do no harm, and some of the things that providers can be doing are harmful, and they don't mean for it to be. I just challenge providers to keep looking for answers. Mm-hmm. These syndromes, I don't know why COVID brought them out more. I feel bad for people that that has, but now we are hurt a little bit more. Mm-hmm. And so I just challenge providers to keep on looking for answers for their patients to help with the hope.
Yeah. So we've been talking here with Dr. Amy Hartsfield, who has actually teared up talking about her work and her patients. And she has been so gracious to share her story with us of everything that she went through, which, my goodness, I think your friends are right. You probably should write a book. So much of a journey that she went on trying to find answers. And now she's helping people do the same thing. And so much of that, I think there's something so special about it being part of your own experience, and you know exactly what it feels like to be in that place. If you are watching this and thinking, this really sounds like me, this sounds like something that maybe I should check into, you're right. You definitely should. This is TMJ and Sleep Solutions of Alabama. Just go find their website, go kind of poke around and see what they offer, and set up an appointment with Dr. Hartsfield, and she will help you find some answers. Thank you for being here, and thank you for sharing your story.
Thank you so much, Ann.